Spice, K2. Spice, commonly known as K2, is a term used to describe synthetic cannabinoids that are sprayed over plant material and smoked to produce a high similar to marijuana. The content of synthetic cannabis can fluctuate, resulting in unpredictable and hazardous effects. Cannabis. Cannabis, a psychotropic substance derived from the cannabis plant, is also referred to as marijuana. It is frequently taken for its calming and elevating qualities. Some people take it recreationally, but because of its possible analgesic and anti-nausea effects, some people may use it medicinally. Heroin. Heroin is an illicit opioid produced from morphine. It produces intense exhilaration and pain relief, but excessive usage can lead to addiction, respiratory failure, and other serious health issues. Heroin usage has serious social and health consequences. Shrooms. Shrooms contain the psychedelic psilocybin, which causes altered perceptions, vivid hallucinations, and a sense of spiritual understanding. Their usage is associated with a low risk of physical harm, but it may have psychological repercussions. Datura. Popularly known as Jimson weed, contains tropane alkaloids with hallucinogenic effects. Ingesting plant parts can result in powerful and delirious sensations, but it also carries a high danger of toxicity and harmful effects. MDA. MDA is a psychedelic amphetamine that functions similarly to MDMA but has unique effects. It can produce feelings of empathy and enhanced energy, but it may also have hallucinatory effects. The long-term consequences and hazards of MDA use are not well recognized. DMT. DMT is a potent psychedelic found in various plants. It causes powerful, brief psychedelic experiences and is frequently linked to spiritual or mystical experiences. Its use is uncommon and should be treated with caution, owing to the uncertain consequences. Cocaine. Cocaine is an extremely potent stimulant that boosts energy, focus, and happiness. However, its usage has been linked to cardiovascular troubles, addiction, and a variety of physical and mental health concerns. LSD. LSD is a powerful psychedelic that affects perception and emotion. It is noted for its long-lasting effects, which can cause vivid, colorful hallucinations. The long-term psychological repercussions are not completely understood. Fentanyl. Fentanyl is a highly strong synthetic opioid used to treat pain. Illicitly generated fentanyl is associated with a significant risk of overdose and respiratory depression, making it exceedingly hazardous. DXM. DXM is a cough suppressant present in numerous over-the-counter drugs. In high quantities, it can cause dissociative and hallucinogenic effects. Misuse can result in major health consequences such as addiction and respiratory problems. Lean. Lean is a recreational drug that contains codeine, cough medicine, drinks, and sweets. It has a sedative effect due to the codeine, but overuse can result in major health problems such as addiction and respiratory depression. Ketamine. Ketamine is a dissociative anesthetic that causes a trance-like state and hallucinations. While used therapeutically for horses, recreational usage can cause disorientation, visual and auditory hallucinations, and long-term cognitive difficulties. Poppers. Poppers, also known as amyl nitrate, are a recreational inhalant that generates a brief head rush and euphoria. MDMA. MDMA is a synthetic substance that affects mood and perception. It is known to cause sensations of exhilaration, increased energy, and emotional warmth. However, it can have negative consequences, such as dehydration and elevated body temperature. Steroids. Steroids, or anabolic androgenic steroids, are synthetic versions of the male hormone testosterone. While they have real medicinal purposes, their non-medical usage, particularly in sports, can result in major health problems such as cardiovascular disease and mood swings. Meth. Meth is a powerful central nervous system stimulant. It boosts energy and focus, but it is highly addictive and has been linked to serious health repercussions like cardiovascular disease, dental difficulties, or meth mouth, and mental health disorders. Nicotine. Nicotine is a stimulant contained in tobacco products, particularly cigarettes. It is highly addictive and causes the release of dopamine in the brain, resulting in a sense of pleasure and relaxation. Smoking is a leading cause of avoidable diseases such as lung cancer and cardiovascular problems. N-bombs. N-bombs are synthetic hallucinogens that imitate the effects of LSD. They are connected with a higher risk of serious adverse effects, such as seizures and organ failure, than LSD. LSA. Morning glory seeds contain LSA, a naturally occurring hallucinogenic chemical. Consuming these seeds can cause altered perceptions and hallucinations, but it also poses hazards such as nausea and vomiting. GHB. GHB is a central nervous system depressant that promotes relaxation and euphoria. While it is occasionally taken recreationally, it can be hazardous due to its limited therapeutic spectrum. Overdosing on GHB can cause respiratory failure and other serious complications. Kratom. Kratom is a tropical tree native to Southeast Asia. Its leaves contain chemicals that can have either stimulating or sedative effects. While some people take it for pain treatment or to treat opioid withdrawal, there are concerns regarding its addictive potential. Salvia Divinorum. Salvia Divinorum is a hallucinogenic plant that generates powerful, short-lived effects when smoked or chewed. It can produce intense hallucinations and change senses. The long-term consequences are unknown, and legality varies by region. PCP. PCP, a dissociative anesthetic, can cause hallucinations, delirium, and distorted perceptions of reality. Its usage is linked to unpredictable and often risky conduct, and it can have long-term harmful consequences. Ayahuasca. Ayahuasca is a hallucinogenic beverage used in Amazonian shamanic rites. It contains DMT and a monoamine oxidase inhibitor, which extends the effects of DMT. Its usage is advised with caution due to the possibility of psychological and physical side effects, such as severe vomiting and diarrhea. Nitrous oxide. Nitrous oxide is widely used as a dental anesthetic and recreationally as a dissociative substance. It causes a transient feeling of exhilaration and changed perceptions. Prolonged or severe use might cause health problems, such as vitamin B12 insufficiency. Bath salts. Bath salts are a class of synthetic medicines intended to replicate the effects of cathinones found in the cat plant. They can cause stimulant effects, such as increased energy and altered perceptions. However, they are connected with substantial health hazards, such as hypothermia and cardiovascular problems. Krokodil. Krokodil is a synthetic opioid made from codeine. Its use has been linked to serious health repercussions, including tissue damage, gangrene, and a variety of skin-related problems. Krokodil earned recognition for its harmful effects on the body. Alcohol. Alcohol is a psychoactive substance that is both legal and commonly consumed. It has the effect of depressing the central nervous system, which lowers inhibitions and promotes relaxation. On the other hand, abusing alcohol can lead to major health problems like addiction and liver damage.